Ever pondered the question, what if the very thing that has the power to obliterate life could also save it? It may sound like a paradox, but this is the intriguing reality of nuclear medicine. Nuclear medicine, a branch of medical imaging that uses radioactive substances in the diagnosis and treatment of disease, has a surprisingly rich history. In fact, its roots trace back to the early 20th century. It was in the early 1930s that scientists first discovered artificial radioactivity, laying the foundation for the development of this field. Fast forward to the 1950s, and nuclear medicine was beginning to take shape. The invention of the gamma camera by Hal Anger in 1958 revolutionized the field. This device allowed for the visual representation of physiological functions happening inside the body using radiopharmaceuticals, a breakthrough that led to the development of single-photon emission computed tomography, or SPECT, in the 1980s. The 1970s and 1980s saw two major advancements: the development of positron emission tomography, or PT, and the invention of technetium-99 the most commonly used radioisotope in nuclear medicine. These developments opened up new horizons for the use of nuclear medicine in cardiology, oncology, and neurology. In the 21st century, nuclear medicine continues to evolve with the advent of hybrid imaging technologies like PT-CT and SPECT-CT. These technologies combine the strengths of two different imaging techniques, providing more detailed and precise information about how the body is functioning and where the disease is located. So, what can we distill from this exploration of nuclear medicine's journey? Firstly, nuclear medicine has come a long way since its inception in the 1930s. From the discovery of artificial radioactivity to the development of hybrid imaging technologies, each advancement has brought us closer to understanding and treating diseases more effectively. Secondly, nuclear medicine is unique in its approach to diagnosis and treatment. It offers the possibility to see not just the structure, but the function and processes happening within the body. This gives medical professionals a comprehensive view of what's going on inside the patient, leading to more accurate diagnoses and targeted treatments. Lastly, the future of nuclear medicine looks promising. The field continues to evolve and innovate, pushing the boundaries of what's possible in medical imaging and treatment. In conclusion, nuclear medicine, a paradox in itself, harnesses the power of radioactive substances to not only diagnose but also treat a wide range of diseases. It's a field that continues to push the boundaries of medical science, providing hope for countless patients around the world. Isn't it fascinating how the very thing that has the power to obliterate life can also save it?